The federal government is considering relaxing its guidance for people with COVID-19 to isolate for 10 days after developing symptoms, particularly for healthcare workers with asymptomatic cases. Anthony Fauci said Monday, as the U.S. faces a likely huge influx in mild breakthrough cases from the highly transmissible Omicron coronavirus variant. Rather than keeping healthcare workers out for 7 to 10 days, if they are without symptoms, put a N95 mask on them. Make sure they have a P. That's how many COVID-19 cases the U.S. could potentially record per day due to the highly transmissible Omicron variant without proper mitigation measures, National Institutes of Health Director Francis Collins warned on NPR on Sunday. The variant is now linked to 73% of new COVID-19 cases in the U.S., up from just 3% the week before, and studies suggest initial COVID-19 vaccine doses are much less effective at preventing infection. Booster shots appear to provide greater protection, though breakthrough cases are still possible, and vaccines do appear to remain highly protective against severe disease and death. The Centers for Disease Control recommends people who have tested positive for COVID-19 should isolate themselves from others for 10 days after symptoms develop, with the day they develop symptoms counting as day 0 and the day after that as day 1 of the isolation period. Those who never develop symptoms should isolate for 10 days after testing positive for COVID-19, but the 10 days would start over if they develop symptoms within that period. As more vaccinated people get breakthrough cases and data suggests they may shed the virus and stop being contagious faster, that guidance has come under more scrutiny. Public health experts have suggested vaccinated people could potentially be let out of isolation once they start testing negative for COVID-19, which may be as soon as 5 days after developing symptoms. Fully vaccinated people are probably not a risk to anybody anymore once they repeatedly test negative, University of Saskatchewan virologist Angela Rasmussen told The Atlantic, though experts acknowledge more evidence is needed before that can conclusively be determined. Omicron is now the dominant COVID variant in U.S. At 73% of cases, Forbes do vaccinated people with COVID-19 really need to isolate for 10 days? Fast Company: why are we still isolating vaccinated people for 10 days? Atlantic full coverage and live updates on the coronavirus.